So behind me is the new Westhull Health Hub, which will be a home for the Modality Partnership, who provide GP services together with increasingly community services. There's a real big push now for health to be delivered in the community and to be pulled away from some of those more hospital-based settings. So this is the start of a new era really, and it builds upon the estate that CityCare have got in the city already with their buildings. Currently the patient list for Modality is having to be treated in poorer accommodation, which historically GPs have worked from converted houses, and that's the case for Modality. They have some premises nearby on Willoughby Road which are exactly that. They are houses which have been knocked into a bigger premises. Accessibility is difficult for them. The space is not necessarily laid out as you would want it to be in the 21st century. So this building will address that and give them a completely fresh start. And it's fantastic for patients in a part of the city which has historically been underserved.
Hi, I'm David Major, Project Manager for the Westhull Health Hub for Seoul Construction. We're currently on week 26 of 54 and works are really progressing well. We've made a significant milestone with the roof now being watertight, and I'm going to take you on a tour of the building. We're now on the ground floor and as you can see, works are progressing well, and I'll take you on to the tour. So within these areas, we're currently putting up the partition walls. We're also putting in the M&E, so ventilation's going in. The external walls, as you can see, have progressed quite well, and the windows are also going in now. So we're now on the ground floor within the waiting area of the main Westhull Health Hub. The floor's getting prepped for screed, which will take place next week. We're now on the first floor. We're in the area that will contain the offices and the waiting area for the clinics upstairs. The external walls are progressing well. This is the final area that will be closed off and then we'll be completely watertight. So this is one of the first floor consultation rooms. As you can see, we've boarded one side of the walls, and we're looking to start boarding the other side of the walls ready for plaster. So we're now at the front entrance of the health centre, just off Calvert Lane, the other side of the hoarding. The area that you can see here that's open currently will be curtain walling, and that's going to start within the next week. There's a cement board that's covering the full building at the moment. That's just giving us water protection to allow us to complete the building internally, and all of that will be clad with either brickwork or cladding.
I am Bushra Ali. I'm a GP in Hull. We got too big for two houses stuck together, and it's still not quite enough space for all of the people who work here with us, because we've not just got GPs, we've got practice nurses, we've got healthcare assistants, we've got trainee nursing associates. So we need rooms for all of these people to be seeing all of our patients all at the same time, and having GPs running between them. The Westhull Health Hub is finally the fruition of a lot of conversations with our patients, a lot of conversations with the local community who, previously we've not been able to agree on a site for our practice. We haven't been able to just knock this one down and quickly build something else that's a better fit, but still in the exact same place that people can get to really easily. So it is going to make a huge difference, in fairness. Having space as well, so our waiting room is so small, and patients there are a couple of points through the day where it can seem really, really busy, and it can almost seem like there isn't enough space for everybody to be sitting down. And so that we can have as many clinicians in, seeing patients, ringing patients, contacting patients, as we would like to have, without being constrained by, well, actually we haven't got enough rooms to have everyone in at the same time. I think just knowing that we can deliver the kind of primary care that we have all wanted to provide, without worrying that it's not possible So providing the breadth of appointments with the range of clinicians that we have to offer, and actually patients having simple, easy access to all of that without it being, oh, you can only have that at certain times of the day, or you can only have that if you can go upstairs. I just want it to be easy so that everybody who is registered with our practices has access to the same across our site, but also across the whole of the city, because this is going to bring us much more in line with the other sites that we have.